This is Royal Manchester Children's Hospital. It's the biggest and busiest hospital for children in Britain. Coming up, a lifeline for Katie from her little sister Ginny.
She might not understand the enormity of it. What she's doing for me is absolutely amazing.
4-year-old Sean giggles his way through A&E.
You got tickly feet.
And 3-year-old Amelia finds out if her brain surgery's been a success. The hospital bone marrow transplant unit is one of the largest of its kind in the UK. For the next 6 weeks, it will be the home to a 16-year-old girl who's bravely battling leukaemia and desperately hoping for a cure. Katie Buckley was a perfectly healthy teenager until a year ago, when she was diagnosed with acute myeloid leukemia, a fast-moving cancer of the blood.
First thing I actually thought was, oh no, I'm going to lose my hair. That's the actual first thing that I thought. And then I thought that they got it wrong, and I just didn't think that it ever happened to me. And it did.
I thought she was going to die. I think that's the first thing that came to my mind. I don't know about you.
It's the C word, isn't it? Leukemia, cancer. It's just so scary.
Katie's already had a 6-month course of chemotherapy, but it's failed to kill off the cancer in her blood.
How are you going?
I'm fine.
Are you OK if I sit there?
Director of the unit, Rob Wynne, thinks a bone marrow transplant is now her only chance of survival.
Yeah.
He's cared for Katie since she was first diagnosed.
Everything is in the right place for you, and you're in good shape. No infection, good blood counts. So this is definitely the right thing to be doing and the right time to be doing it. We're here to look after you, and we expect this to go well.
It's really reassuring to have a doctor like Robert Wynne, because he's makes everything sound really easy, even if it's not going to be, but he just reassures you and it makes you feel better about the treatment.
And the pennies are on
The vast majority of children with a blood cancer, however devastating that diagnosis is, can be made better.
We only had the same conversation.
But there is not 100% good news. She has serious leukemia, and honesty dictates that not all children with relapsed myeloid leukemia will be cured of their illness.
Katie will now get a much stronger course of chemotherapy to kill off her entire blood-making system, the bone marrow. This will prepare her body for the transplantation of new, healthy bone marrow cells in 10 days' time.
The chemotherapies that I've had before have made me really sick, so I think I'm quite used to it now.
It's just part of the process of getting better at the end of the day, and that's all she wants. So she's wanting to take it on, you know. And it is a battle with cancer, and she's a battler.
Hello.
Most patients rely on the kindness of strangers for a bone marrow donation, but luckily for Katie, her 11-year-old sister Ginny is a perfect match. She's going to give Katie the very best chance of a cure.
When I found out I was a match, I was really happy because I want to help Katie.
What she's doing for me is absolutely amazing. She might not understand the enormity of it. What she's doing, she's actually saving my life, and that's just absolutely amazing.
This won't be easy for Katie. There'll be a lot of ups and downs, and we can't guarantee that we'll get through this at all. But in terms of the best chance of having Katie grow up as a woman, this is the treatment that gives us the best chance of that.
The hospital's short-stay patients are looked after by the staff on Ward 76.
Can you confirm Amelia's full name for me, please?
Amelia Pringle-Price.
3-year-old Amelia is here today with her mum and Nana, 8 months after having major brain surgery.
Did you hear something? What did you hear?
Amelia has an extremely rare condition called moya, which means the vessels that supply blood to her brain are so narrow she could have a potentially fatal stroke at any time. Her 7-hour operation involved diverting a blood vessel from the side of her head and stitching it onto her brain. The aim was to increase her blood flow to reduce the risk of a stroke. The The operation went well, but its success can only truly be established once she's had a series of brain scans, the first of which is today.
Are you not singing it? Are you just going to word it?
She's putting on a brave face, but it's an anxious time for Mum Natasha.
The operation doesn't count for anything until we've had the scan, so it's exactly the same as it was before. The risk of the stroke's still really high. Still check her about 18 times in the night.
Just going to lie like that?
Yeah. So hopefully today is going to bring us good news.
Are you Amelia Pringle Price? That's for you then, isn't it?
Amelia will have a general anaesthetic to make sure she stays totally still during the scan. It's a procedure she knows only too well.
I will be fast asleep, and then when I click again, I will be fast away, and then I can eat my breakfast.
With Amelia safely asleep, a series of detailed images are taken of her brain. The images will detect if she's suffered any minor stroke since her surgery. They'll also reveal the development of any new blood vessels, bringing much needed oxygen to her brain. The procedure's over in just half an hour. Back on the ward, Amelia's wide awake and enjoying her long-awaited breakfast.
Good girl. Are we hoping that it worked?
Yeah.
Are we hoping that you're getting better? And we're hoping the operation was worth it?
Good job.
Amelia and her mum will be back for those critical scan results in a couple of weeks' time. Sharon Buckley is on her way to visit her daughter Katie on her 17th birthday.
Hi, darling. Hello. Not feel too good today.
Over the last week, a gruelling course of chemotherapy has been destroying Katie's cancerous bone marrow in preparation for a transplant in 4 days' time.
Right.
It's having nasty side effects, but she's being incredibly brave.
Started a new chemo today and it made me sick 4 times after breakfast, so I'm not feeling too good.
Katie's a very resilient girl. She comes into transplant having spent most of the last year in hospital, but she still did fantastically well in the GCSEs. So I think her resilience is there for all to see.
I spent my 16th birthday in hospital, and now I've spent my 17th birthday in hospital, and I'm determined not to spend my 18th birthday in hospital.
On her 18th, she'd be being sick for a whole new reason. Alcohol.
My perfect 18th would be all my friends and no parents.
I'll dress like a teenager and sneak in.
Four days later, the morning of the transplant has finally arrived. Down the corridor from Katie is 11-year-old Ginny. She's about to go to theatre to donate her bone marrow to her older sister.
I've not really slept that well because I've been worrying about me and Katie and been quite nervous about today. The doctors have just said to me that if anything does happen to Katie, that it's not my fault. I'm the best possible chance that she has. No, I'm glad it's me because I really want to help Katie.
Katie's cancerous bone marrow has now been wiped out by the chemotherapy. She's too ill to see her sister, but she has sent Ginny a good luck card.
To Ginny, thank you for saving my life. You are so brave. I couldn't have asked for a better sister. You are a star. Love from your eternally grateful sister, Kate.
A bone marrow transplant is Katie's only hope of beating leukaemia, but it's a high-risk procedure which is not always successful.
We were hoping we'd never get to this. We were hoping that the chemotherapy would work. But now she's relapsed. It's the only chance Katie's got. It's the only thing that, that can now work. So for us, it's massive, massive. I don't think there's ever been anything as massive.
At At the Royal Manchester Children's Hospital, 17-year-old Katie is about to undergo a bone marrow transplant that could save her life. Over the past week, a gruelling course of chemotherapy has destroyed her bone marrow in preparation for a transplant of new, healthy blood cells. In theatre, 11-year-old Ginny is preparing to donate her bone marrow to her older sister.
My actual concern is for Ginny, because I don't want her to be in a lot of pain. I think what she's doing for me is absolutely amazing. It makes me really proud of her.
Do you want to give her a kiss? She's actually off to sleep now. Okay, we'll look after her for you. That's all. Well, thank you very much.
Director of the unit, Rob Wynne, who's cared for Katie since the day she was diagnosed, will perform the transplant.
We've given Katie chemotherapy to get rid of her own bone marrow, to get rid of her leukaemia. So we need to do a transplant to rescue her bone marrow and her blood-making system and her immune system. So it's an absolutely vital thing that we're doing, and we're very glad that Ginny is in that anaesthetic room coming through to be harvested now.
From the day they're born, you want to protect your children, to make them grow into adults, and all of a sudden something comes along where you can't do that anymore. And that's the hardest thing about cancer. That's why your consultant becomes so important to you, because they are the only person that you feel that can help your child where you can't.
So these are hollowed out needles which we push through into the centre of the bone and then just suck up blood stem cells. Once they're put back into Katie, they will find their own way, miraculously, to Katie's bone marrow, where they will then make blood in Katie's body forever. We're going to go for about 600 mils. That's a very safe amount that it's not going to cause Georgina any harm, and we wouldn't take more because her well-being is paramount too. What we're going to do is take the elixir of life and take it up to the stem cell lab, where it will be processed into a product that's suitable for reinfusion this afternoon.
3 hours later, Ginny's bone marrow arrives on the unit, ready for Katie.
I'm Trevor, known as the Marrow Man.
It's fed directly into her veins through a drip.
Okay, we're going to run this in over about an hour, and then it's up to you.
Monumental, isn't it? You can't realise the enormity of it, really, can you? Life-saving, that is.
Now, Katie faces the greatest fight of her life. Her and Ginny's blood cells will battle for control of Katie's body. If the transplant is to work, Ginny's healthy cells must win. The hospital's accident and emergency department is open 24/7 and sees over 700 children a week. 4-year-old Sean's just arrived and is enjoying playing with all the toys. But Sean isn't here just for the fun of it. He's hurt his foot and limps in to see the man in charge of the department today, Professor Simon Carley.
So what have you been up to?
Look up on the scooter.
You fell off a scooter. So whereabouts is your foot sore?
It's here and that side. Yeah, it looks sore.
Yeah. Because just feeling the ankle here, I think your ankle feels quite good, actually. You've got tickly feet. That's not going to make it very easy.
But what are you doing?
I'm feeling little bones in your feet. Yeah, you've got lots of little bones in your feet. Is it sore for you? Oh, don't like that one, do we?
Don't do it.
I won't do that one again. It's probably just worth just taking a quick x-ray of the foot.
Yeah.
And just making sure that these bones down here have not got a little bend in them.
It's off to X-ray to see if there are any broken bones.
Say cheese.
The results are back and Sean finds the X-ray of his foot strangely amusing.
This is a picture of your foot. Your foot, this is your foot. And looking at this, it doesn't look as if I can see any major breaks on there. The one thing that we always say, though, at this age is if you look on here, there's lots of little spaces. That's where the bones are growing. And at this age, you can often get a little crack at where the bone is growing. It's still technically a break, but they heal so quickly and so well, we just treat them as sprains.
Okay.
We just give him some paracetamol and see how he gets on over the next week or so.
Okay.
Will that be all right?
Yeah, that's fine.
Sean, is that okay? Well, Sean, you're definitely the happiest person we've seen today.
No, I want to laugh at you. Shoot.
You can laugh at me, I don't mind.
With some rest and a few more giggles, Sean will be back on his feet in no time.
Bye!
Three-year-old Amelia's back at the hospital today with her mum Natasha for the results of her brain scan.
Oh, you puckered up there, haven't you?
The results will be the first indication of whether the extensive brain surgery she had 9 months ago has been a success.
Let me say, oh, beautiful. Can I have a kiss? I want some. Thank you. It's just been really nerve-wracking. Like, now I just want to get in and find out. I'm sick of waiting now. Because the operation was big and it was important, but this is to see if the operation was worthwhile. If not, it was all for nothing. So it needs to be good news.
Amelia's being seen today by the man who performed her complex 7-hour operation, neurosurgeon Ian Kamali. The surgery involved diverting an artery from the side of her head and stitching it onto the surface of her brain. If it's worked, her blood flow will have improved, reducing the risk of a stroke.
Say hello.
Hi there, how are you doing? Fine.
Are you being shy?
How have things been?
Fine. Everything's been great. She,
Good.
Since the last time, you've seen no problems at all. She just seems to be non-stop growing.
Right. So the first stage of the follow-up was to get the MR scan. This is the scan from before the operation, and this is the one from September now. You can see, compared to here,
like
on this side, you can just see that there's a suggestion that there's more blood vessels, more blood getting in on that right-hand side. And, you know, that's really reassuring. That's exactly the kind of appearance we're looking for at this early stage scan. That looks great. It's looking exactly what we want to see.
Woo! Is that good? Yeah.
So the most important thing is that she's doing well and she looks fantastic.
Thank you.
That's a pleasure.
See you next time.
See you next
Thanks
time.
a lot. Thank you. I'm really happy. I just feel so relieved because you could clearly see the major difference. So fingers crossed. We can do everything like normal kids do without having to think, oh, is that going to be too much for her? Will it bring on a stroke? Are you happy?
Good job.
Amelia will need to come back to the hospital for a further scan in a few months' time, but the initial signs are promising and her future's looking good.
Gonna put this on.
It's
You've had
2
this
weeks
done
since 11-year-old Ginny donated her bone marrow to her older sister Katie.
I feel and I look like I've been in a fight because mine and Ginny's cells are both actually fighting to take over my body, and hopefully Ginny's cells will be the cells that will win.
She knows herself that she's been through a battle, but she doesn't complain. She just gets on with it, and she's a really tough kid.
It's been an anxious wait to see if the new donor blood cells have started to work. But today, Dr. Wynne has some news.
Top marks, things going good, Mrs. Graft working nicely, blood count slowly coming up. Quite a few blood cells from your sister. They'll just come up and up. But right on time. So you're only 15 days, is it today?
Yes.
You got the score up there, have you? Good. Let's have a good hand slip.
One of the miracles of bone marrow transplantation is that the donor cells learn that they will live in the patient's body. They become re-educated. And without those cells, Katie's risk of infection would be much higher. Her risk of relapsing leukemia would be much higher. So this is hugely important to see those cells in Katie's blood, and they're right on time.
You're looking better. So we'll stop the IVs slowly over this next week, and then you know, get you out at some point. So I think things are going well.
All the pain that I've been through, it's all been worth it in the end because I know that the transplant's actually working and it's hopefully going to be a success and I'll be able to go home then.
2 weeks later, Katie gets her wish. After 6 long weeks in hospital, she's finally well enough to go home.
What do you want to do with that, Kate? Slough did that for her.
I'm really looking forward to going home, seeing my sisters and get out of this room and be in different surroundings and I get to sleep in my own bed again.
I'm looking forward to all the family being together and, you know, it's all been one family again. That's what I'm looking forward to most of all. Back to normality.
You won't see me. Bye. Bye.
It will be several years before the hospital can give Katie the all clear, but her sister's healthy blood is now working successfully inside her. She's free to go outside for the first time in 6 weeks, breathe in the fresh air and get on with her life.